Hello friends, I am Dr. Harvinder Singh, and in this video we will discuss the role of N-acetylcysteine NAC for the management of treatment-resistant OCD. And this 5-minute video is actually a section from Psychiatry Education Forum's first CME conference. As many of you know, this conference was released in March of this year, 2020. And just for this 72 hours, we are giving this conference for less price here, which is a Black Friday sale. We have dropped the price by 30%. So you can see the price range here. And also we have discounts for residents, students, and our core subscribers. And if that applies to you, please send me an email. I will put all the information below. So friends, without wasting any time, let's begin the discussion on N-acetylcysteine's role in the management of treatment-resistant OCD. Moving on to next medication, which is N-acetylcysteine NAC. Now, let's begin with the study, but before that, I will summarize the mechanism of action for NAC. So we all know we talked about NAC in our section on the augmentation strategies for major depressive disorder, but NAC is a precursor of cysteine, which and modulates the cysteine glutamate antiporter, which is known to have efficacy in serotonergic flow. And the dose of NAC that this study used was up to 2400 milligram per day. Well, this study actually had 48 patients with OCDs they have failed to respond to the adequate doses of SSRI. And patients were randomized to 2400 milligram per daily dosing of NAC or placebo. And this study also used Y-box score and followed these patients. So NAC assigned patients showed a significant improvement in the Y-box score. And also NAC patients, almost 52% were full responders at the end of the study. And so this was a very, very positive study. And I found most data for NAC to be truthful. And most studies used this dosing of NAC. So let's see if there was any other study that talked about this. Another study was a double-blind, placebo-controlled, 10-week trial for moderate to severe OCD patients. So patients were randomized to receive 2,000 milligram daily dosing of NAC. So you see the dosing range should be really good for NAC to be effective. So this study used 2,000 milligram daily dosing, and NAC showed a positive response in terms of reduction of total and obsession subscale in Y-box compared to the placebo group. And as you can see, the medication was added to fluvoxamine here for both groups. Now, they recommended that NAC is an effective augmentation agent for moderate to severe OCD. And as I mentioned, most data that I found was for NAC after antipsychotic and anticonvulsant class. So I will just spend some time talking about that now. So if you ask me what dose was found to be more effective, I will say the dose between 2400 to 3000 milligram per daily dosing for a minimum of 8 to 12 weeks. And studies have preferred 12 weeks as an ideal dosing for NAC, N-acetylcysteine. And on a side note, there was an article published in JAMA Psychiatry in last year or so. It showed the efficacy of NAC in a dose ranging from 1200 to 3000 milligram per day for 12 weeks in skin picking disorder, excoriation disorder, which also have the underlying theme of OCD, that obsession and compulsion theme. So if you use NAC, you should aim for a dose ranging from 2400 to 3000 milligram and you should use this for at least 8 to 12 weeks. And many people ask me, how do you initiate N-acetylcysteine? So this is how you do it. You initiate the dose at 600 milligram per daily dosing, and you double this dose every week to reach a maximum dose of 2400 milligram per day by week 3. And don't mind, when you in your PDF booklet, all this information is there. I have not made slides here for the video presentation, but in that PDF booklets, you have 1 or 2 slides that will talk about this. And also regarding adverse events, the most common adverse event with N-acetylcysteine is GI side effects. I should say mild GI side effects of nausea, vomiting, or diarrhea. But studies have shown that these GI side effects improves after 2 weeks of NAC treatment, and some cases have noticed skin rash. So, this was our discussion of N-acetylcysteine for treatment-resistant OCD. Aim for a dose ranging from 2400 to 3000 milligram a day for minimum 8 to 12 weeks. Now, so friends, this was a very short section from one of the lectures from this conference. As you can see, this was from chapter number 4 here on obsessive compulsive and related disorders. We have total 9 different lectures here, and you will get CME credits for those also. But again, if you're interested in learning more, please click on the link below and definitely get the Black Friday sale benefit before that 30% discount expires. But again, any questions for me, I will put my email below. Don't hesitate, send me a questions. You all have a good day now. Take care. Dr. Singh signing out. Bye for now.